How's it going, everybody? Marine Corps veteran Paul Corbett here from the SITREP. And today we're going to be talking about community care at length. What is it? How do veterans use it? What about urgent care, emergency care, all that stuff? And today we're joined by Kim Smith. Hello, Kim.
How are you?
Good. And you currently oversee the entire community care program for New England.
Correct.
And you've actually been involved even at a national level in the program from the get-go.
Correct.
If you could kind of walk us through that a little bit.
Sure. I've been with the Office of Community Care for about 3 years now. And when we first went live, the Mission Act came into play on June 6th of 2019. And prior to that, we did a lot of work with the national office to get ready for this implementation and see what worked, what didn't work, give our feedback. I worked in the medical center prior to coming to the Office of Community Care, so I brought a lot of experience with what the veteran experience is and what they enjoy, what they don't enjoy, what they need, just feedback from them so that we could roll that into the ease of making an appointment and using community care.
So for a lot of veterans, I mean, I hear it all the time, we had choice. Mm-hmm. And now we have Mission Act, right? So what's the difference? And, you know, veterans that are still walking around with their choice card in their wallet, should they keep it or what should they do with it?
Absolutely not. So that's the first rule. Get rid of the choice card altogether. That program no longer applies as of June 6th when the Mission Act law went into play. The Mission Act is a huge law, and community care is a piece of it. And that community care piece does differ from the Veterans Choice Program. The big difference is now that the VA has a robust network, and we hired a third-party administrator to help us with that, to build that high-quality network. It's better known as United Healthcare. It's referred to as Optum here at the VA. Optum is part of United Healthcare. And with Choice, we didn't have that robust network. Now we do. It's kind of like myself, when I go out use my private insurance, for instance, Blue Cross Blue Shield, I have a network, and I can choose from any provider within that network. And that's how the new community care program is. We have a robust network. Optum maintains that network and continues to add on providers. If they were originally part of United Healthcare, they can join on to it's called CCN, and CCN stands for Community Care Network, and that's the VA network of providers within the community. So the veteran is able to go close to home. For instance, if they lived in Boston, all of the hospitals, Mass General, Dana-Farber, all within the Community Care Network, and Optum maintains that network and continues to add to it. But before, with the Veterans Choice Program, when they had the card, it wasn't a network. It was just a network of different providers. It wasn't a robust network that is managed by one TPA, which is the third-party administrator.
So there must be a lot of major advantages now to it being that way.
It is, especially when it comes to credentialing, because Optum owns that piece. So Optum takes care of the network part of it, as well as paying the claim, and the VA does everything else. So with Optum, you can look at it as our company that specifically builds this network and takes care of credentialing all of the community providers. And when I say credentialing, they go through and make sure that they're properly licensed, the quality of care, they monitor all of that and take care of all of that piece, and they pay the bill for the provider.
Awesome.
And we do the biggest change from Veteran Choice going back to Choice to this program is the VA also, we took on the care coordinating. So there's the Office of Community Care at each medical center has a team of nurses, a team of administrators, and they care coordinate that veteran from the beginning until the end, and pretty much hold their hand, making sure the appointment is made, making sure they're getting the proper appointments, care coordination throughout of it, answering any questions they have, and following up on that care.
So it sounds kind of like they're using we use PAC teams for everything. So it seems like they're now utilizing that model for everything that's out in the community.
Absolutely.
So for a veteran that's out there who maybe is just now for the first time, or a family member of a veteran is just now for the first time hearing about community care, and doesn't really understand it, there are particular requirements that must be fulfilled by a veteran in order to qualify to use it.
Correct.
And so what are those requirements?
So you do have to be eligible. The major thing is you have to be enrolled in the VA healthcare system. And you're going to always want to work with either your PCP or whoever your care team is at the VA. And there are certain eligibility. There are 6 different criterias in order to be eligible for community care, but you only need to be eligible. To be eligible, it only has to be 1 out of that 6. It doesn't have to be all 6.
Okay.
So out of that 6, for instance, one of them is if there's not a full-fledged medical center within the state that you reside in. And here in New England, that would be New Hampshire. We don't have a full-fledged medical facility. You would automatically be eligible for community care. Another eligibility is distance and wait time. And we can get into the ins and outs in that afterwards. Another one is best medical interest. If your VA provider feels that it's in the best medical interest for you to see an outside provider, then he can make that choice and that decision, making you eligible for community care. Another eligibility is if the VA doesn't offer it, for instance, maternity. The VA does not offer maternity, so that you would automatically be eligible for community care if the VA does not offer the service that you need. And there's also a quality standard. If the VA that you need the care isn't meeting the quality standards that the VA expects, you will also be eligible for community care.
So a lot of different ways to qualify.
Yes, there is. Absolutely.
And so for a veteran who is enrolled, because it's not like a retroactive thing. I can't use community care and then call it the VA and be like, oh, I want to enroll in VA healthcare and have you pay my bill.
Correct.
So for veterans who are currently enrolled that would like to utilize community care as an option or to supplement some of their needs health-wise, how do they go about? Is it just as simple as starting a conversation with their primary care physician? Or
correct. So you want to start that conversation. Let them know if you do want to go into the community. Your team may even suggest to you to go into the community, and they would start that process with the Office of Community Care at the local medical center, and they need to create a referral. So it's really important to remember you can't just go into the community. We want to make sure that bill is paid, so you need to have that care authorized by the VA even prior to scheduling an appointment in the community. You want to work with your primary care provider. And your primary care provider will put you in touch with the local Office of Community Care, and they'll walk you through those steps to receive that authorization. So any routine care does need pre-authorization.
And so you kind of touched on it, which was going to be my next question. How does a veteran go about scheduling the appointment out in community or out in the community rather? And it sounds like every region has a care office, so to speak?
Correct. So every medical center has a local Office of Community Care department, and they can help you. They're the ones that are going to issue that referral. And it's important to remember that referral is you're going to get a copy of that referral, and the provider that you're going to see is going to get a copy of that referral. It's important to have that referral in hand because that's your authorization to go into the community. It's your okay. It gives all of the information about yourself as well as the treatment that you're going to be receiving. So both the veteran and the community provider receive a copy of that. Once you have that referral, you're free to either make that appointment on your own. A lot of veterans like to do it because they know their own schedule, or the Office of Community Care that you deal with will be happy to make it for you and give you a call. Because they're going to be, like you said, the PAC team, they're kind of going to be your coordination team once that referral is issued. They're going to work with you. But like I said, most veterans like to schedule their appointments on their own, but we will do it for you if you don't want to.
And in the event that a veteran has scheduled an appointment, whether they did it themselves or it was done through the community care team, and something happens and they can't make that appointment, is there a different procedure in rescheduling or having just straight up missed an appointment? Like, how do both of those kind of play out?
So it's really important. We don't want to have those missed appointments, just like we don't want to have them within the VA. So the veteran can call that community provider directly. I would encourage them to. They can also let their Office of Community Care know. But you always want to make it a rule to call that community provider and let them know that you can't make it. And usually that provider will then call the Office of Community Care and work with them. That authorization is still going to be good as long as it's within the periods and it hasn't expired. So by rule, always call, cancel the appointment, and then work with your local VA to either reschedule it or just give them the heads up that, hey, I canceled it and we made it for next week. Because those dates do matter on that authorization. For instance, if you were to go today, you were scheduled to go today and you don't go, and you go next week, that changes the authorization by a week. So you want to get that full length on the actual referral.
And what if it's deemed by the provider out in the community that there needs to be follow-up care? Or maybe I went to a dermatologist and had something removed in their office. And they're like, oh, I want to have you back, in a week or 2 weeks or a month or 6 months.
Right.
How does that, do they just go ahead and schedule that? Is that a part of the process already? Or
Yep. So that provider, when they get that referral package, there's a thing called a CEOC. It's a standardized episode of care for what that veteran is being sent for. So for example, your example of dermatology, within that packet, there's an outline of what the doctor can do. And anything related to your diagnostic treatment is what he'll be able to perform. And he can work with the VA if there's something he wants to do that's outside of that scope. But as far as follow-ups, I would say 99% of the CEOCs include a follow-up appointment to be seen. In fact, every CEOC has a number of visits that they're allowed. And again, if it's to go over that, the provider knows by their contract to work with the VA for a new referral or to just ask a general question on if a certain procedure is allowed within that CEOC.
And what about veterans who may have a chronic issue? So maybe like I could get chiropractic care or acupuncture or those things through the VA. Some of that stuff is provided, it's even provided here on this campus, I believe. But if I had to go out into the community and, it's a chronic issue and I've been going to a chiropractor for 2 years and this is something that I want to just continue using long term, is that a possibility? Or
So after each referral, like I said, has a number of visits. For instance, chiropractic has a number of visits. And after that number of visits, you have to work with the internal VA, again, to issue a new authorization. Because we always want to come back to your clinician here at the VA to find out first, okay, so you've done, say, 15 visits and you're still not feeling well. We want to revisit that and find out why, and maybe you need some other type of treatment. So it's not an ongoing thing. It's limited by the number of visits in that referral, and then they'll clinically review that to see if they can grant additional visits. So you can't just continue. You can continue going into the community, but you always need that authorization, and it does expire, but it expires for a reason, so that the VA can clinically look at you and figure out, okay, what's going on. Again, in the best interest of the veteran, to make sure they're getting the proper treatment, to make sure this is working, or maybe we need to go down another avenue.
Interesting. Makes sense to me. So for a veteran that is in the community care program and they need to use urgent care, how does that work?
Okay, so urgent care is a new benefit that came about with the Mission Act law on June 6th. And urgent care is a benefit where you do not need pre-authorization. You're able to just go to the urgent care facility. However, you want to go to an urgent care facility that's within the VA network, and that can be found on our VA external website, www.va.gov/communitycare. They can go there, and there's a provider directory for urgent care, and you pop in your address, and it will give you a listing of all of the urgent care facilities that are close to your residence. And again, you can just present there. If you do go to that website, what's nice about that, or on your mobile phone, you can pull up it's a veteran card on your mobile phone, and it will show the urgent care facility, that they are in network and that you're a veteran, and that's right on the website. The urgent care facilities that are in network also have a process when you present. They call and just make sure that you are eligible. If you have any questions, being the veteran, and if you're eligible, there's a 1-800 number on the website that you can call, and they can also help you find a location if you don't want to go onto the website. But again, there's no pre-authorization needed. And the way to be eligible for urgent care is you do have to be seen within the VA within the past 24 months. So first, be enrolled in the VA healthcare system, and within the past 24 months, you had to have been seen in the VA in some fashion, and that can include community care. As long as you were seen on the VA time within the last 24 months, it makes you eligible for urgent care.
Interesting. Okay. So with regard to community care, a veteran who is in the program, and they end up, they're raking leaves in the backyard with their family, and a whole horde of bees comes out of nowhere and stings them, and they need to go to the emergency room. Ambulance comes and picks them up and everything else. How do they need to go about that process, whether it's informing the VA or what have you?
Right. So that process does differ a little bit from urgent care. So for emergency, obviously, you feel like your life is in danger. You would obviously call 911, or a family member bring you to the nearest emergency room. That does differ from urgent care. So for urgent care, obviously, you don't feel like your life is in danger. You can go there for scrapes, bruises, infections, eye irritation, minor injuries. For emergency, you do not need authorization either. You can absolutely go to your nearest emergency room. The important thing to remember about that is that a loved one, yourself, as well as the community provider, needs to notify your local, we have a new process, the National Call Center, within 72 hours of admission. So just letting them know that Joe Smith presented to the ER today and give all the information so that we can make sure that we properly pay that community provider. And more importantly, we can care coordinate. For instance, if you're admitted, normally a loved one or the community provider would contact that national hotline, and then that national call center lets your local VAMC know, and they would pick up the care coordination piece and make sure that you're either transferred back to the VA or, schedule the follow-up appointments. They would care coordinate that entire visit. But that 72-hour notification is key to making sure everything pays smoothly, care coordinates smoothly. So you really want to get your max benefit, you want that 72-hour notification in place, which is a 1-800 number, again, on the community care website. And it doesn't have to be yourself. It can be a loved one, a friend, as long as that notification is made within 72 hours.
Making that notification, though, within 72 hours is not a requirement with urgent care?
It is not. You do not need to notify us for urgent care. Nope. Just the emergency benefit.
So I'm guessing it may be the fact that because wherever they're seeking emergency care is not actually in the system, whereas the urgent care would be in our system and would notify
Correct.
VA that
they have to, because in order to get urgent care, you have to be within the community care network,
right.
In order for that bill to be paid. And yes, they create their own authorizations and work with Optum directly. For emergency, you're going to go to the closest ER that may not be in the VA network. Most of the hospitals are, but also the main piece on the notification is so that we can properly care coordinate from the beginning. But they do give you the 72 hours as far as and to properly get paid and reimbursed for the greatest benefit as well.
So I know that a lot of veterans who utilize VA healthcare receive travel reimbursement for their trips to and from a VA medical facility or to a clinic in the community. Is that the case with community care?
So if you're eligible for Benny travel to a routine appointment within the VA, you're also eligible with community care. Nothing as far as that eligibility changes. So if you're receiving Benny travel for a VA appointment, it would be the same exact process for the community.
So for a veteran that goes out in the community,
Mm-hmm.
whether they used urgent care or emergency room or whatever, and a couple weeks later or a couple months later, boom, they've got a bill in the mail.
Mm-hmm.
What do they do?
I would suggest calling your local Office of Community Care that you work with, and they can route you in the direction of who to call or how to fix it. A lot of times it might be, we have that new 1-800 line for notification. Maybe there was some miscommunication or, there was a piece missing or information missing. But don't panic when you get the bill. It does happen. The community care program is relatively new. Like I said, it just went live back a year ago. It could be an issue. Optum is really good about trying to fix issues. The network is huge. It's very robust. But it does happen, especially where, veterans, they're not walking around with a card like you would in the private world. And some of them have dual insurances. You might have Medicare, Medicaid, as well as your VA benefit. So there might have just been some confusion with the person at the hospital, and they may have billed the wrong insurance. So those sort of things, you can filter them through your local Office of Community Care, and they'll let you know who to contact and get it rectified. And also on our website, there are many different channels and resources on who to call. Sometimes veterans, if they get the bills or they didn't even know they got the bills and it hit your credit, there's an adverse credit report hotline on our website for them to call, and that staff will walk you through the steps to getting that corrected.
So does a veteran need to make a choice with regard to community care, whether to go to the community or to go to the VA? Do they have to use one or the other, or can they use both at the same time?
You can use both at the same time, as long as your care team, and again, as long as it's authorized. We always want to get you back into the VA. So once that episode is done, a lot of people think once they're in the community, they have to stay in the community, and that's not true. We want to get you back into the VA and get you set back up with appointments. And if it was best medical interest, or for whatever reason that you need to re-enter the community, then we'll grant you another authorization. But you can use both, maybe for chiropractic, and for dental, you're being seen internally. You can absolutely use both.
Oh, so they can use, for veterans that qualify for dental, they could also potentially use dental out in the community?
Yes, so that's new with the Mission Act as well.
Oh, wow.
Dental used to be just within the VA.
Right.
And now they follow those same standards. So if there's an access issue or any of those 6 criteria making you eligible for community care, it applies to dental as well.
That's good to know.
Yes, so that's brand new. That's veterans may not be aware of that, but the local offices can assist you with that too. For instance, White River Junction doesn't have a dental clinic, so those veterans have the right to go into the community with pre-authorization.
Right.
Yes.
That's important. So that brings up another question that I wanted to ask. That there are particular things within the VA
Mm-hmm.
that you don't need to see your primary care physician to schedule an appointment for. For instance, like if I need to get new eyeglasses, I can go ahead in the VA system and just call the optometrist and set an appointment for that day if they've got an opening for that day, which they usually do.
Mm-hmm.
Is that also the case with community care? I mean, is there some type of like vision place that I can just go to out in the private sector and just get it knocked out that day, or do I still have to go through primary care to do everything out in the community or what have you?
You still need that authorization from the VA. So
Okay.
that's just the key part of it. If you're able to schedule it same day, that's fine, but you need that authorization in place prior. So that's key. you can't just go into the community and schedule that appointment. You want to make sure you have that authorization in place from the VA. So you could call your eye doctor here within the VA and let them know you want community care. They're going to figure out if you're eligible first to go into the community. And if you are, they can call over to the Office of Community Care and get that process started for you. It's a very simple process. If you're eligible, it's pretty simple from that point on, but you just don't want to go making an appointment without that authorization.
I imagine community care has to be, it's opened up a lot of new avenues and opportunities, especially for individuals that have families.
Correct.
To be able to potentially use the exact same provider as your kids or, your husband or your wife or whomever, that's big.
Yeah, makes it much more convenient, especially for our younger population. They're very busy, with life, and if they can just go down the street rather than, driving an hour to the VA, it's very helpful.
So you'd spoken about the fact that there's now a new national call number. Do veterans call them for, or the loved ones of a veteran call them for everything, or?
Nope. So that's just for our emergency. So if a veteran self-presents, if the VA sends you, that's a different story because we're sending you. So we're able to start that care coordination, that referral. But if the veteran self-presents, we just need to know about it. So what used to happen was the loved one or the veteran themselves or the community hospital will call the local VA. We have since changed that and created one national number so that the community provider isn't trying to figure out who do I call, who's the closest. Here in Massachusetts, we have Central Western Mass, we have Boston. So it leaves that guesswork, in Bedford. So there's 3 of them. Leaves that guesswork out, and they just call one phone number now.
I could even be visiting family in South Carolina
and
or
not
something.
know who to call.
Right.
Yep, exactly. So they call one national number, and then that national number will coordinate with your local hospital to get that care coordination started. But they take all of the intake information, your name, your social, all that information that they need, the community provider's information, so they can get the wheels rolling on that authorization. Seeing that the VA didn't send you, because when we send you, the authorization is in place. We didn't send you, so there's one hotline, one-stop shopping for the loved one or the community hospital to call, or email. They can call or email. And set that up with them rather than trying to figure out which hospital to call or which hospital your loved one belongs to. So it's a much easier process. The biggest thing I just want to keep reminding, and I know I've said it over and over again, is that pre-authorization, except for urgent care and emergency. Urgent care and emergency, you're free to go on your own. And with emergency, as long as that notification is in place within 72 hours of admission. And again, for urgent care, you can just freely go. Our website will give a lot of information on the urgent care benefit as far as copays. That depends on your priority eligibility, your assignment. It goes by which priority group you fall into. And one really important thing to remember, whether it's urgent care, emergency care, routine care, the community providers do not accept the copay. You're not going to pay them anything. That bill comes from the VA. You are not to pay the community providers anything up front. That bill always comes from the VA, and you pay through the VA. So that's one important thing to remember. Don't ever pay anything out of pocket when you go to a community provider. That copay is done on the back end with the VA and yourself, not through the community provider. We do have some veterans that insist on paying. Please don't. That needs to go through the VA only, not through the community provider visit.
For a veteran that has gone to a provider out in the community through the community care program, and at the end of their appointment, they're prescribed something. What's the process for having that filled? Okay,
so there's 2 different processes. If it's through the urgent care benefit, that urgent care facility, they can write you a 14-day prescription. Opiates are 7 days, and that's because of the law.
Right.
In order to get that filled, if it's an urgent care facility that prescribed the medication, you're able to go to one of the in-network pharmacies, which is typically CVS, anything that falls under the Caremark. And again, the urgent care facility can let you know what the closest pharmacy is, and you're able to get that 14-day prescription filled. Anything over 14 days has to come back to the VA. But getting back to the urgent care piece, you'd go to that in-network pharmacy. You wouldn't pay for that. That would be paid again by the VA through your benefit for urgent care purposes. If you're to go to the emergency room or to your regular doctor's appointment and they want to prescribe you an urgent or emergent medication, they do have the right to write that prescription, but again, it cannot go past 14 days. And if you were to fill that in the community, that would be the one time that you would pay out of pocket any pharmacy. And again, this is for emergency or any doctor's visit that prescribes you medication for 14 days. You would pay out of pocket, and then you would work with your local VA to put a claim in to reimburse you for that medication. Or if you don't want to pay out of pocket, you can go back to your local VA and have it filled there. So 2 processes. The urgent care is part of a network and they will pay for it. But if it's anything outside of the urgent care and it's an emergency room, or if you went to see a specialist and they need to put you on an antibiotic, they can do so, but for 14 days or less. And then that is the one prescription that you would pay out of pocket and then be reimbursed at the VA, or simply go to the VA and then you won't have that out-of-pocket expense. And
so if I want to avoid the out-of-pocket expense, I mean, why do I want to pay a bunch of money for meds if I can get them for free, right? Do I just walk into a VA facility and bring it to the pharmacy, or do I have to talk to my primary care physician first?
So you should be able to go straight to the pharmacy. I know every hospital is a little bit different, but we always encourage to go to the pharmacy, and they will explain whether you need to chat with your primary care team or whatnot, but I would go directly to the pharmacy.
Okay. Well, Kim, thank you very much for joining us today. That's a lot of really good information. And like you had said, the web address that everyone needs to go to?
Yep. So www.va.gov/communitycare. And then from there, there's several resources as far as urgent care, emergency, routine care, claim and billing, everything is there. So /communitycare.
So to everybody out there, just like Kim said, if you're looking for information with regard to community care, you can check out that URL. And also, if you're looking for more content like this, search #TheSitRep on YouTube and begin connecting with the benefits that you have earned and deserve.